Hi, my name is Alexel Tubelleza. I am a BSBA Human Resources student, and today I am going to impart knowledge on sexually transmitted diseases, or STDs, for us to have awareness on how to prevent and lessen the risk of getting one. So, what are STDs? Sexually transmitted diseases are very common. Millions of new infections occur every year in the United States. STDs pass from one person to another to vaginal, oral, or anal sex. Every one of us has needs and desires. One of these needs are sex. On your right is Abraham Maslow's hierarchy of needs. It is important for us to be open and address sex in order for us to have knowledge and know what to do if we ever contracted one of the sexually transmitted diseases. STDs are pretty common of every two adults will get in their lifetime. Some of them are treatable, and unfortunately, some of them are not. Some of the treatable sexually transmitted diseases are that of caused by bacteria, and some that are not treatable are caused by viruses. Some of the sexually transmitted diseases that are commonly known or you might have heard of are gonorrhea, chlamydia, syphilis, herpes, HRV, or AIDS. The first image is chlamydia, an STD that is contracted by bacteria. This can cause permanent damage to a woman's reproductive system. The second one is gonorrhea. This is a venereal disease involving inflammatory discharge from the urethra or vagina. The third image is syphilis, a chronic bacterial disease that is contracted by infection during sexual intercourse, but also congenitally by infection of a developing fetus. Symptoms of the mentioned STDs are painful urination, vaginal discharge in women, discharge from penis in men, and bleeding between periods and after sex. STDs that are caused by bacteria can be treated by antibiotics. However, that are caused by viruses does not have any cure yet. Let's talk about how to prevent or lower your risk in contracting STDs. I am going to discuss 6 things that are advisable to do. The first thing is barrier protection. Just by using a condom is already protecting yourself to STDs. Using condom, internal female condom, or dental dams are a big step to protect yourself. The second thing is just limiting the partners that you have, because the more partner you have, the more risk you carry. The third thing that is advisable to do is just communicating with your partners about sex. It is good that we are open about the topic of sex. When was the last time that each of you got tested for STDs? This is good that we communicate so that we know that our partner cares about the safety of each other. The fourth thing is that if you're going to use sex toy while participating in sexually active activities, that you don't share and learn how to use and clean them afterwards. The fifth thing that we must take into consideration is to avoid alcohols and drugs before sex. If you are choosing alcohol and drugs while engaging in sexual activities, sometimes people tend to do reckless things that they might otherwise choose not to do if they are sober, such as engaging into kinks and roleplay. So it is recommended that you limit the dosage of those before or during sex. Getting tested regularly. The last thing that I recommend is to get tested frequently. I know that it can be scary and embarrassing to get tested, but it is a responsibility to you and to your partners because some STDs don't show no symptoms, so you will not know until you get tested.